So here we have our PA waveform. So it's got a good dichrotic notch and it's always gonna be the yellow. So we're gonna go ahead and press more and then wedge. I'm gonna store trace here. I'm gonna take a peek at it. Mind you, we are on a demo monitor. So normally your PA systolic and diastolic are going to correlate to your QRS and your QT interval. No matter what, you're going to find end expiration, so about here, and your diastolic, you can tap the arrows, find that, identify it at about 16. Typically, your systolic is going to line up exactly with your QRS. On the demo monitor, we don't get that luxury. Then you're gonna go ahead and go up to your systolic. Same thing with the arrows. We're at about 28 here. You can also use these and arrows and measure. Either way, you're going to get that good identification of waveform, always with end expiration. If you have a ventilated patient, this is going to be a little bit altered, but you can still use your QRS and QT interval as good guidance. And now we can go ahead and show you our wedge. I got 28/16 for our PA, which is our normal PA numbers, not on your patients that have funky hearts. We'll go ahead and show you our wedge. Okay, so to get our wedge, we're gonna go to more and then go to the wedge screen. We'll see our PA waveform. And then I'm gonna take our syringe, pull back 1.5 of air, and then very slowly inject it until we get our wedge waveform, which is right here. We'll click store, edit wedge. Okay, so first we have our A wave, which is going to represent peak atrial contraction during ventricular diastole and atrial systole. This is also a good measure of our left ventricle and diastolic pressure on the wedge waveform. Then we have our V wave, which is going to represent atrial filling. At this time, the mitral valve and the tricuspid valve are closed during the TP interval on your EKG tracing. The atria begin to empty when the valves are open. We also have our dichrotic notch on this PA waveform, which is going to represent valve closure. Okay, to get your cardiac outputs, you're gonna click more, and then you're gonna go to start CO, and then you're gonna come to your syringe. You're gonna wanna turn this off to here so that you don't pull back like from your CVP or from your line. So pull in your D5, 10 mLs. You're gonna turn that back off to your CVP. You're gonna click start CO. And then once it says inject now, then you're gonna slowly but steadily inject your 10 cc's. And then you're gonna turn that back off to there. And then wait for your waveform to show up. Since this is the demo screen, it's not gonna work, but you should see a tall wave. And then when it's done, you'll have your cardiac output. Once you have your orange cardiac output cable hooked up to cardiac output box, you can go ahead and hook up the thermistor piece to the syringe itself. It'll slide right in, as well as the cardiac output cable, which is going to be this blank white part here, the other attachment to this cable, which they both come together. Then, when you shoot your cardiac output numbers, you should expect to see a slight uptick and then a straight downward curve after that. And it'll look like this as it's running across as well. If you see a lot of jagged edges, or if you see a very abrupt drop off and it's not a true waveform, then you can probably count that number as inaccurate, and you can do up to 3 trials or more if needed, but generally your numbers are going to be within 1 of each other. If you wanted to reject a result because it comes up with a question mark, all you have to do is tap it and it will read itself out. That way when you go to save your cardiac output data, it won't store that value for you, but it'll store your other one.